All right. So overactive bladder is very troublesome to many, many people. When someone starts having symptoms of overactive bladder, like frequency, going to the bathroom often, urgency, having really strong sudden desires they can't delay, or even accidents, what is the first thing they should do in changing their daily routine?
Well, I always tell patients, especially women, the most common reasons why people get overactive bladder or lack of estrogen is one, and then dietary. So, dietary things like having a cup of coffee or something with caffeine in it, or having a glass of wine or something with alcohol in it, are things that you can, avoid strategically. And I always tell them you don't have to cut it out completely because people are not going to do that for the long term. So,
Yeah, absolutely.
I think another thing that many of us don't think about as we age, because I'm in that bracket now, is when we're younger, we might be able to hold for prolonged periods of time. You're at work, you don't have time to use a bathroom, and then suddenly you develop these symptoms. So some of it can just be staying ahead of the symptoms, right? So a little bit of time voiding, not putting it off until the urge comes on, and then I always tell patients then it might be too late. So just changing your behavior a little bit, as Kathleen said, thinking about your fluid intake a little more consciously, timing when to drink, what to drink. And a lot of women come in, especially if the symptoms are fairly new in the onset, sort of thinking they have a UTI, right?
Yeah.
So they immediately want to get antibiotics, thinking that, that might be the right way to go. And so it's a little bit of education as well.
Yeah.
I think patients intuitively do a lot of things that we would recommend. They start to pay attention to what they're drinking. They start to fluid restrict. I think we have this sort of culture of hydration is essential, and it's so great for appetite suppression and other things. But I think sometimes those habits can catch up to you later. I also see a population of patients that has fallen into the trends of both the diabetic medications that cause a lot of sugar to be in the urine, and also weight loss medications. And I think those definitely have pelvic floor effects that can affect it. So I usually tell them take inventory of medications. If you are on medications, take inventory of what you're taking, because sometimes there can be medication side effects that play a role. And then as my friends said here, pay attention to your diet, and then also your pelvic floor. What's the status of your pelvic floor? Where are you in the menopause journey? Because sometimes that can be a part of it as well.
Absolutely. And I think just you made a good point. As we age, things change and you can't get away with the same things you used to get away with. But you mentioned pelvic floor. So let's talk a little bit about pelvic floor physical therapy. Is that something people should be pursuing when they have overactive bladder symptoms? And do you find that it helps?
I absolutely think it helps. I'm a big believer in pelvic floor physical therapy for a bunch of different indications. One of the interventions that I think is super helpful is actually not when overactive bladder starts, but it's when the injury happens. So for example, if you, after you have a baby, maybe you can compensate for the symptoms. Maybe you don't really have a lot of urgency at that time. You can manage just fine without the PT. That's a great time to invest because your body will respond. There's data that shows that there is a lot of healing that can happen right after delivery that can be really helpful and a great investment in the long term. So I'm a believer in it whenever, if sex starts to get a little bit painful, if you start having a little bit harder time controlling your urine, it's always a great time to invest in physical therapy. And as someone who has participated in physical therapy recently, I can tell you that you get to know so much about your body, whether it's physical therapy for your ankle or physical therapy for your pelvic floor. You learn so much that it's not just about exercises and stretching and knowing the muscles. It's also about getting to know how things work, and that can help you sort of protect yourself from further injuries or from further urinary symptoms.
Yeah, I would agree 100%. I think, PT can be much more encompassing than just learning exercises, right? A good PT will talk to you about diet and fluid and behavior. And so a lot of it for overactive bladder is behavioral training, learning how to use pelvic floor exercises, maybe to suppress an urge or to eliminate or improve incontinence. But more than that, just looking globally at the patient and helping them kind of restructure their habits along with PT to sort of, do the behavioral changes that maybe are hard to do on your own. And I think about it, think about how we use it in the pediatric population. None of us do pediatrics, but they use a lot of that kind of stuff in the pediatric population to change behaviors at a young age. So why not do the same later?
And I also agree. I think it's really important to get patients involved in their care. And by doing that, it's an active participation in their own health. Also, there are things that we have in our head and it doesn't translate to what's going on down there. So you think it is, but the PT can help, with the biofeedback, really making sure that the things that you think are happening down there or that you think that you're trying to do down there are actually what's happening. Also, I think that progress, when people see the progress from session to session, even if it's a few weeks in between, that's encouraging. It's like I always say it's like having a personal trainer at the gym. And then they teach you these tricks and exercises, and then they coach you on whether or not you're progressing or if you're doing it right. And I think that active participation is really effective.
Yeah, absolutely. And I think the beauty of it is you really get an understanding of your baseline pelvic floor. Like, is it tight? Is it loose? Is it weak? What can you do about it? Because everyone's a little different. And so your physical therapy journey can be personalized to you, whereas it's not just doing Kegel exercises, like a blanket statement. And I think that's really great about physical therapy. And I think it can make a huge difference.
And I think just to add to that, most women don't know what their pelvic floor is.
No. Yeah.
Right? We kind of use that term loosely. Maybe they've heard of Kegels. Many have not. In New York, they call them Kugels, which is a dish we eat, but that's a separate story. But I'll just add, I actually went years ago when I first started practice. I said, let me go for a few sessions just to see what they do. What does it feel like when they do biofeedback or muscle stim? And I was shocked at how difficult it was for me to do a Kegel and tense those muscles because I had not been doing them after childbirth. Mm-hmm. So it's a lot easier said than done. And for me, it was a big learning session in terms of, what I'm telling my patients to go seek out, that it can be very challenging. It's not so intuitive.
Yeah, that's really fascinating. I really respect that you did that, and probably all of us should do that and experience what our patients are, because of all people, we should know what you should be doing down there, right? The other thing that it sort of made me think about is that it's really important to talk to patients in a language that they understand, right? And I really feel like I've changed my scripting a fair amount since the pandemic, because we had to do everything sort of virtually, whether you wanted to or not. And you had to have these analogies for patients to understand that their bladder is like a balloon and the valve muscles where the knot is, and, things. Those little tricks are probably in and of itself an interesting conversation about how we explain things to patients. But you got to make sure that what you're saying is transmitted also. So,
yeah.
And maybe that's some of the advantage of being a female in this space, right? A female physician. Is that many of us have had children, many of us might develop some of these issues, and so we understand. And I think it's intuitive and obvious that patients just in many ways relate to us a lot easier, and we relate to them.
Yeah, absolutely. In terms of the habits that we've talked about, like avoiding caffeine or alcohol, or timed voiding, going on a schedule, or other habits, what do you feel like are the easiest for people to stick with or start with?
I like timed voiding. I think it's easy to put yourself on a schedule and just sort of see how that goes. I think it allows you to listen to your body. I think a lot of patients have something that I've heard be called turnkey incontinence, or this type of incontinence where your bladder sort of knows that you're getting home and you're about to open the door to get into the house, and then all of a sudden the sense of urgency is really strong. I've had many patients resonate with that. And so I'll tell them, the same way that your bladder is trained to recognize your daily habits, you can work that brain bladder connection in your favor. So I've begun to integrate that in the counseling. And while I wasn't a believer in this in the beginning, because I found that compliance with this was pretty low, once we changed our way of communicating with patients about the importance of something like a bladder diary, they actually do them and bring them in and like to discuss them and share their perspectives about it. So I like the timed voiding, this sort of bladder training. I do think that it works a lot better than we initially thought it did. And when they're really inclined to do a lot of behavioral modifications and don't really want to pursue medications or something more invasive, that's a great option.
Yeah, and just what is a bladder diary for people who don't know?
Absolutely. Oh, a bladder diary is, and the first thing I tell patients when I tell them to keep a bladder diary is that you don't have to write in your bladder diary every day. 1 or 2 days worth of information is more than enough to get a picture, especially if they're spaced out in a regular day for you. So just keep track of it. And what you want to keep track on it is monitoring what you're drinking. So every time you have something to drink, you just record the ounces or milliliters of what you're drinking and the time that you did it. And then you have a little hat, or you can use different methods to measure what you're urinating. And also, if you are unfortunately having accidents, you can also record when they're happening and the context in which they're happening. A lot of times we'll also tell patients to record whether they feel urgency when they have the leaking, because that guides us in a specific direction as far as treatment is concerned. And that's pretty much it.
Yeah.
You record that and you bring it in, and then we can find out so many things with the bladder diary: your functional bladder capacity, when the problems are happening. Is it specific to a type of activity? Does it happen in the day and the night? Are your hormones, not the hormones related to estrogen, progesterone, but actually the hormones that control your fluid status in your body? So are those hormones maybe disrupted by your sleep-wake cycle, and maybe you're producing too much urine at night for other reasons? It gives us so much information. It's really easy to keep, and I think it's a really nice intervention for the beginning.
Yeah. Anything else that you think is pretty easy for people to do?
I would say the 2 things that come to mind, reducing caffeine. Again, not telling them blanketly to eliminate, but you'll be shocked. Sometimes people will tell you what they drink all day, and every single beverage is caffeinated.
Yeah.
And they don't realize that what that does in terms of diuresis and bladder stimulation. So, I try to be realistic, maybe change 25% of what you're drinking to something non-caffeinated. If you like tea, use an herbal tea that's non-caffeinated, or a soda that's non-caffeinated. I think, that's a fairly easy change you can make. And of course, the second thing I was going to say flew right out of my head. So I'll let somebody else.
Well, I was going to
it'll
tell a
come back to
story.
me.
I mean, I moved to Houston from Seattle. In Seattle, when I used to say no caffeine and no alcohol, I mean, it's wine country and coffee country.
Yeah.
People looked at you
Get
like you had
fired.
3 eyes. So I was like, okay, that's when I changed a little bit. And I said, just be strategic. If you're getting on the plane and you've got the window seat, you already know you're not going to get on with a big old cup of coffee, right? And so if you've had a glass of wine and you're going to the movies or somewhere where it's not assigned, don't sit in the middle of the middle, right? So I kind of tell them that. But I do have a story from, probably 15 years ago, 20 years ago now. I had a sweet little lady. She must have been about 80 years old. And I said, do you drink caffeine? And she says, no, not really. And I said, okay, well, how much do you drink in a day? And she said, oh, about a 6-pack. And I said, a 6-pack of what? And she said, Mountain Dew. She didn't know. I mean, so that took 15 seconds to tell the story, and that changed her. That was all she had to do, was switch to Sprite or something, But so, I mean, I think taking that time is worth that for the patients. The other thing is urgency suppression techniques.
Mm-hmm.
I mean, I think those are a little harder to do, but that works for some people. I don't know if it's easy or not, but where you do the quick flicks, it's like the quick Kegels, or you do sort of think about something else. I call that the turnkey. I call it the garage door syndrome. And when you say it to people, they're like, I have that,
Yeah.
Yeah.
So if you say, listen, you're not at the garage, you don't push the garage door open, you have to think about something else when you push the garage door opener. What am I going to make for dinner? How are the baseball teams doing? Whatever it is, what does your foot feel like in your shoe? Whatever it is, think about something so you can get there. And that, for some people, really can make a big difference. But again, the caffeine and the alcohol is not the cause of overactive bladder for every single person. So some people
Right.
will come in and say, I cut all the caffeine out, I went through the headache thing and everything, and I still have overactive bladder. Then you can go back on your caffeine, for heaven's sake. But, I mean, I think it's not one size fits all.
Absolutely. What are some other trigger foods that we haven't touched on that for some people become a problem?
Spicy foods. I think spicy foods can be a trigger. I live in San Diego, so everybody loves spicy food. And I find that is very hard to take away. When you mentioned relatively easy to cut caffeine, in my mind, I'm like, not easy for me. Definitely would be very difficult. But I think spicy food. And then the other one that was surprising to me, I've heard several patients tell me this, is chocolate.
That's caffeine, maybe.
Yeah.
You know?
Yeah.
You know, tomatoes, some citrusy stuff that you start to get into maybe the painful bladder syndrome kind of people, or you know, I shouldn't say spectrum, but you know, like that spectrum, I guess, right? I mean, some of it is just experimentation, but you don't want to make it so rigid that they're not going to comply, right?
Yeah.
And we know from lots of studies, even with painful bladder syndrome, that even the strictest diet in many patients is ineffective. So I think like everything we do in medicine today, it has to be individualized, an individualized approach. And I never thought of this until now when you asked, but maybe think of it like an allergist. Like you have to eliminate one thing at a time and figure out what's triggering the allergy or triggering the urgency in overactive bladder, because for each person it might be different. There might be people who can eat lots of spicy food and it doesn't affect them.
Exactly.
The one thing I would add is a lot of patients drink a good amount of fluid. It might not even be caffeinated from dry mouth. And so many medications that they take cause dry mouth. And there's a lot of other solutions to dry mouth other than just drinking and drinking and drinking, which never really eliminates the dry mouth. So that's another point, something that might be easily fixable by recommending products for dry mouth, sucking candy, chewing gum, ice cubes, drinking little bits at a time. Those are simple things that most people can do.
Yeah, and we're definitely like a hyper-hydrated society. People are walking around with their 40-ounce water bottles and filling them up over. And of course, if you drink a lot, you're going to urinate a lot. And so just realizing that, like, you may enjoy drinking a lot, but it's going to make you urinate quite often. In terms of, you know, when people start having overactive bladder, sometimes they have incontinence. And so they start looking for incontinence pads and underwear, and that can be sort of expensive and uncomfortable. So how do you help patients navigate that? Like, how do you help them figure out what the best product is versus like, hey, maybe it's time to look for a medical treatment?
Again, very individualized, talking to the patient about what their goals are and making sure that their goals are realistic with what we can accomplish with the tools that they are interested in utilizing. And then, you know, I tell them about the whole spectrum of things, even just briefly early on. So I know that your other guests are going to be talking about some of these other minimally invasive therapies, but just to give them a roadmap and so that they don't get discouraged. Because if you just say, hey, we'll see you, call us if this doesn't work, they're not going to call. You say, I'm going to see you by telemedicine in 3 or 4 weeks and check in and see how you're doing. And these are the other things that we can, you know, we can talk about. And I say not because I'm not optimistic that this is going to work, but I don't want you to get discouraged if it doesn't.
Right. Yeah, that's a great point. I don't really recommend specific products because obviously everyone's different and there's so many products out there today. What I have recommended to a lot of patients, mostly from feedback from my patients, is the washable cotton reusable underwear that's now available from many different companies that has varying degrees of built-in cotton pads that are absorbent specifically for urine because, there's a whole separate market for menstrual underwear like that. And a lot of women really like that. It's a little bit more cost up front. They're not inexpensive, but then they're machine washable and you're not going through boxes and boxes of pads. I think as women, we are so used to wearing pads our whole life that women just accept, okay, now I'm at a stage in my life where I now have to wear pads again. Whereas when you see men who've had prostate cancer treatment, if they leak 4 drops a month, they're in the emergency room.
Yeah.
And the pads are not designed for men, so they're horribly uncomfortable. So I think women are just so much more accepting, but there's also a lot of consequences besides the cost. You know, contact dermatitis, irritation of the skin, the vulva, lots of other, and then, lots of patients believe that it leads to urinary infections if they're in wet pads, maybe not. So I have a lot of patients that have turned to these washable underwear, and I think that can be really nice.
I found that patients rarely ask me for advice on what incontinence products to use. They typically know. Usually how can I get the cost of this to go down, or I need to do something because I can't afford.
Yeah.
Typically what their insurance will cover is usually not what's most comfortable, most absorbent, or less irritating. So it's more of something that I receive from them. They'll tell me, hey, this product is amazing. If you have anyone else who is having this issue, just let them know. This worked really well for me. And then one thing that you said that really resonated with me that I think is a great idea for patients who are coming in to see any physician really, and that I ask patients is the first thing, hi, how are you doing? And then what are your goals for today? What do you want to get out of this visit? There's so many options, especially for overactive bladder. And we do spend a period of time counseling people on so many different treatments. And that's a great standard approach to just counsel on everything. And that's usually what we'll do. But when patients come in with a goal and an agenda and they say, I'd love to have options that aren't invasive. I don't want to be on another medication. Or maybe I just want to know that everything's okay and I can live like this. I just want to know that this isn't something more serious. When they come in with those goals, it's so much easier to give in that time that you spend with them to give them what they're seeking when that agenda is set out from the beginning. So that's, I think, a great pearl of wisdom.
Yeah, absolutely. Now, obviously, this is a very stressful and for many people embarrassing situation to have. Oftentimes, they've delayed coming to see us for years, sometimes decades, before they actually come in. So how do you help patients with that sort of emotional and psychological toll?
I mean, I kind of joke around a little bit and I say, this is why I have a job. I mean, this is all I do, and this is why I have a job. It's so common, right? The reason why there's pads on the shelves, and we don't want to keep them in business, but the reason why there's pads on the shelves is because this is very common, and I'll tell them same kind of thing with, we're not talking about UTIs, but I say the only reason to take cranberry supplementation is for UTI avoidance or, prevention of UTIs, and they sell it at Costco. That just tells you how many people are experiencing it. So, just normalize it.
Yeah. And that's when we have to switch into our psychoanalytic mode and just be a therapist, right? Let them talk, listen, validate their concerns, their frustrations, and then give them the encouragement that it's not only common, but very treatable.
Yeah.
And one thing that I think urologists particularly do intuitively, because we know we're dealing with people that are very hyper aware of the problem being highly intimate, is to give them that space to sort of feel comfortable and also express, why they're there, what they're feeling, the discomfort they're feeling. And I heard a piece of data that I thought was really interesting. If you give a patient 90 seconds of uninterrupted time to talk to you about what their goal is, they feel heard. It doesn't take that much time. So usually physicians are told, listen to the patient. And a lot of times it creates anxiety for the physician because you have an agenda filled with 30 patients. And if you're not on time, that also affects you. But if you just give 90 seconds, let them tell you what's on their mind, what their agenda is, what they're uncomfortable about, why they're there. After that, it really just helps them kind of get it off their chest, feel heard, and the visit just goes so much better after that.
That's great. Well, thank you guys so much. This has been so helpful. And yeah, that's it.
Thank you. Thank you
Thanks.
for having us.
Thank you.